All right, let's talk about something that affects literally hundreds of millions of us, chronic back pain. For decades, the way we even talked about it has been, well, pretty unhelpful, sometimes even damaging. But that's all starting to change. So today we're going to dive into a groundbreaking new language for understanding and, more importantly, treating one of the world's most common problems.
You know, it all starts by getting rid of a really terrible name, failed back surgery syndrome. Just think about that for a second. The name itself screams failure. Is it the surgeon's fault? Or even worse, is it somehow the patient's fault? This quote from the new guidelines says it all. The term is misleading, and honestly, it's insulting. It's a label that blames instead of explaining.
And we need to be clear about the scale we're talking about here. It's just staggering. In 2020 alone, 619 million people around the globe were dealing with low back pain. That makes it the single leading cause of disability worldwide. And it's not getting better. By 2050, that number could be over 840 million. So yeah, this is not some small issue. It's a massive global health crisis that is screaming for a better approach.
Okay, so if we're going to build that better approach, we first have to understand why the old one was so broken. See, the labels we were using weren't just words on a chart. They were actively shaping how doctors and patients saw the problem, and a lot of the time, they were leading everyone down the wrong path and just creating this cycle of frustration.
This right here shows that shift in thinking perfectly. On the left, you've got failed back surgery syndrome. It's negative, it's super narrow, and it's all about the surgery. But the new term, persistent spinal pain syndrome, or PSPS for short, is totally different. It's neutral, it's holistic, it completely avoids that blame game, and, this is so important, it recognizes that this kind of awful chronic pain can happen even if you've never ever had surgery. So here it is, the new official term. Persistent spinal pain syndrome. It's just a much better way of describing chronic pain that starts somewhere in the spine. What's really key here is that it applies to the entire spine. We're talking neck, mid-back, low back. And it finally separates the pain itself from the question of what caused it. It just describes the problem, which, as it turns out, is the most critical first step.
And this is one of the biggest leaps forward. PSP is split into two types. Now, type 2 is for patients who have had a spinal surgery that just didn't work. That's the group that used to be stuck with that failed label. But look at type 1. This is a brand new category for people who have chronic spinal pain but have never had surgery. This is huge because for the very first time, millions of people who've been suffering now have a real, formal name for their condition.
But, just having a new name isn't quite enough. If you really want to treat pain the right way, you have to understand where it's coming from on a much deeper biological level. It's not just about the anatomy, it's about the very mechanism of the pain signals themselves. This is where we get into the why behind the ouch.
So let's think about it like this. When you feel pain, what is actually going on? Is your body sending out a totally legit warning signal because some tissue is damaged? Or is the nervous system's wiring itself kind of faulty? Or maybe, has the body's entire alarm system just gotten way too sensitive?
So the first type is called nociceptive pain. This is the most straightforward kind of pain, you could say. It's that true warning signal. It comes from actual tissue damage. Like when you pull a muscle or have an arthritic joint. Your body is correctly and helpfully telling you, hey, something is wrong here.
Next up, we have neuropathic pain. This is our faulty wiring. In this case, the problem isn't the muscle or the joint, it's the nerves themselves. Some kind of lesion or disease has damaged the communication system, so it's sending out pain signals without a real reason. If you've ever heard of the burning or shooting pain of sciatica, that is a classic example of this. And finally, there's nociplastic pain. Think of this as the oversensitive alarm. With this one, there's no clear tissue damage, there's no nerve lesion, but the nervous system itself has basically rewired how it processes signals. The volume knob on pain gets cranked all the way up, making a person hypersensitive. And let me be clear, the pain is 100% real, but its origin is in the processing, not in the body part that hurts.
Okay, so we have the new name, PSPS, and we have these three pain mechanisms. So how do we put it all together to actually help someone? Well, that brings us to this really elegant solution that researchers developed. It's called the PAM-C scale.
Now, to really get the power of this new scale, the researchers compare it to something doctors already use all the time, the TNM system for classifying cancer. Right? Just like TNM gives doctors this super specific, universal code to describe a tumor, the PAM-C scale does the exact same thing for chronic spinal pain. It creates a common language for diagnosis and, most importantly, for treatment.
So let's break down how this actually works. It's an acronym, PAM-C.
First, P is for the PSPS type. Did the patient have surgery or not? Type 1 or type 2. Simple. Next, A is for the anatomical location. Where is the pain? Is it in their neck, their low back, maybe shooting down a leg? Then we have M for the dominant mechanism we just talked about. Is it nociceptive, neuropathic, or nociplastic? And finally, C is for certainty. How sure is the doctor about all this?
Let's see how this plays out in the real world. A traditional diagnosis might sound like lumbar facet-mediated pain. Kinda clunky. But with the new system, it becomes a simple code, P1A5M3C1, and instantly, that one little code tells any other doctor anywhere in the world that this patient has pain without surgery, it's in their low back, it's caused by tissue damage, and the diagnosis is definite. It is incredibly precise and so much more efficient.
And look, all of this precision isn't just for some academic paper. It leads directly to what really matters, making smarter, more personalized treatment choices for every single patient.
This is really where the system becomes a game changer. By knowing the main pain mechanism, doctors can match the therapy to the specific type of pain. So if the code shows the pain is neuropathic, that faulty wiring, then another surgery to fix the anatomy might be totally useless. Instead, that PAMC code can point them toward treatments like spinal cord stimulation, which directly targets the nerves. The big idea here is to get the treatment right the first time, avoid needless surgeries, and hopefully stop people with type 1 pain from ever becoming type 2.
You know, at its heart, this is what it's all about. It's about creating a shared, precise language so that doctors and researchers can work together better, design smarter studies, and ultimately find the best possible way to reduce the immense suffering that chronic spinal pain causes for so many people.
And that kind of leaves us with a fascinating thought, doesn't it? In this high-tech world of ours, with all the advanced imaging and complex surgeries, what if the most powerful tool we can possibly develop is simply a better way to talk to each other? A common language, built on clarity and understanding, might just be the key to unlocking a whole new era in managing pain. Thanks for joining me.